today's video, we'll be talking about painful sex. What is painful sex? What are the causes of painful sex? I will be telling you about the classification of painful sex. Also, I'll be telling you about the causes, what you can do to help yourself if you're experiencing painful sex. And also, I really want to know, when do you feel this pain during sexual intercourse? At which point or which particular area? Is it at the vagina opening? Is it around your limbs? Is it around your abdominal area? Welcome to my YouTube channel. I am Nurse Patience. In today's video, we'll be talking about painful sex, also known as dyspareunia. If you are new to this YouTube channel, you are yet to subscribe, please kindly hit the subscribe button. Do not forget to turn on your notification button. Yes, this channel have been made specifically to tackle issues that has to do with women's health, the general well-being of both men and women out there, and even family health as a whole. If you're interested in this particular content, then you need to stay and be on guard on this channel. So what is painful sex? Painful sex is also known as dyspareunia, which is a medical term that is used for it. It affects both men and women, but it is more common among women. This pain can be classified into superficial or deep pain. Before I talk about dyspareunia, I need you to know that the external genitalia, or what you can see as the female reproductive tract, is not called the vagina. The whole structure there is not the vagina. A lot of parts came together to make it. So the general thing you are seeing there is known as the vulva. The vulva is that external part of the female reproductive tract that you can see. So I'll be pointing them out for you. We have the labias, we have the labia majora, we have the labia minora, we have the clitoris, we have the urethral opening, then we have the vagina. Then just below the vagina, there is a skin, the skin between the anus and the vagina, which is known as the perineum. So it is very important we have this little knowledge before we go to talk about painful sex. Dyspareunia is classified into superficial and deep pain. Yes, for the superficial pain, this is the pain you feel during penetration. This pain is usually felt at the vaginal opening. The pain can either be sharp, throbbing, or even dull in nature. So these are the characteristics of superficial pain. For the deep pain, it is usually felt around the upper urethral opening or around the lower abdominal region or the abdominal region. This pain is usually sharp, it can be dull, it can be throbbing, depending on what you feel during this moment. This pain is usually caused by thrusting. So at this point, for the deep pain, it is not caused by penetration but thrusting. Thrusting is the cause of the deep pain. So we'll go straight to looking at what are the causes for each of these pains that I have just spoken about. Be it superficial or deep pain, it is the origin now that tells you what is really happening there. So in order to get help, you need to be able to open up to tell your healthcare provider at the exact point where you feel this pain and during which phase of sexual intercourse do you feel the pain. The causes of superficial pain, which is superficial dyspareunia. One of the causes of superficial dyspareunia is vaginal dryness. What do I mean by vaginal dryness? Vaginal dryness can actually cause this particular pain because the fluid the vagina is meant to produce a lot of fluid during sexual intercourse, and this fluid comes about as a result of the foreplay or arousal activities before actual penetration. And when this is not there, it becomes difficult and it makes the whole activities painful for the woman. What do you do to be able to treat vaginal dryness? Vaginal dryness can occur immediately after birth or for a woman who is breastfeeding. This is as a result of a drop in the level of estrogen. So not to worry about that. This is a physiological condition. But for those who are experiencing menopause, they can also have vaginal dryness. And to augment for the lube or the fluid that the vagina is supposed to produce, you can go in with water-based lubricant. Example of such is the KY jelly. The second cause of superficial pain is vaginismus. What do I mean by vaginismus? Vaginismus is known as the tightening or the hardening of the muscles of the vaginal area. Once these muscles become very tightened, it becomes difficult to allow penetration, even when there are gynecological processes or procedures that are supposed to be done around the vaginal area. It will be so difficult. Why? Because the vaginal orifice is very tight, making it very difficult to allow passage of the penis. The third point is genital injury. How can genital injury affect or cause pain during sex? Genital injury or sore around the vagina, the female reproductive tract, can actually make sex painful for such an individual. The fourth point is genital warts. Genital warts can cause inflammation and sore around the female reproductive tract and make the whole activity painful and discomforting for such an individual. The fifth is thrush. Thrush of yeast infection can actually cause swelling and tenderness and redness of the female reproductive tract, making sexual intercourse painful for such an individual. The next causes we'll be looking at is the causes for the deep pain. Like I told you, the deep pain, the causes of deep pain can be classified into medical treatment or medical conditions. So these are the major things that actually cause deep pain. I was able to come out with 5 causes of superficial pain. So we'll be looking right into the causes for deep pain. What are those reasons or causes for dyspareunia that are deep, felt around the abdominal region or during thrusting? Surgical interventions is a major one of it. Why am I saying this? Surgical interventions such as women who have gone through maybe cesarean section, surgeries that have to do with the fallopian tube, ovaries, the uterus. These surgeries during healing tend to cause scarring of some of these tissues, and these are the tissues that are part of the female reproductive tract. So the scarring causes pain and would affect the normal pleasure or the normal comfort the individual should have during sexual intercourse. The second cause of deep dyspareunia is endometriosis. Endometriosis is that condition in which the tissues that are found around the lining of the uterus are being found outside the uterus, around the ovaries, maybe fallopian tubes, and other areas where it is not supposed to be found. When this condition happens, or individuals with this condition, they would experience painful sexual intercourse. The third is ovarian cyst. By ovarian cyst, a cyst is a fluid-filled sac, and it is usually located around the ovary. So these cysts tend to press on the ovary. During sexual intercourse, they would cause pain to such an individual, as the penis tend to move the cervix and even the uterus, or move the uterus around during sexual intercourse, causing such an individual pain. The fourth is PID, pelvic inflammatory disease, are a group of disease that are caused by sexually transmitted bacteria that affect the upper reproductive tract of the female, and when this happens, it would cause pain to such an individual during sex. Fifth is cystitis. Cystitis, what do I mean by cystitis? Cystitis is an infection of the bladder. If you know the anatomy of the female reproductive tract very well, you notice that the bladder is just found beneath the uterus. So anything that would affect the uterus would affect the bladder. So with inflammation caused by infection of the bladder, there is an inflammation of this bladder, and when there is sexual intercourse, it would cause pain to such an individual. The next cause of painful sex we'll be looking at is the emotional cause of it. Emotional causes of pain during sex. Emotions are a major part of human being and the human life, and how you feel about something is very important. How you feel, your disposition towards sex is very important and would affect your feeling towards it. Either you accept it or you tend to be discomfortable doing that. So it is very important that the emotions of individuals at the time of sex should be checked, should be observed and noticed, to know what is really their disposition at that point in time. So I'll be sharing with you some causes or emotional causes that would actually cause pain during sex. One of it is women who have been in a traumatic situation or condition previously would definitely not enjoy having sex and would have pain anytime they are having sex. Traumatic conditions such as rape, sexual assault are part of those things that when an individual have experienced them, it would alter their perception and make them feel pain when they are having sex and would not enjoy it. The second is depression. Yes, individuals who are depressed would not attain sexual arousal. Sexual arousal is very important for every sexual activity, as this would sort of make the person prepare for the activity. If you are having depression, or individuals who have depression, they tend to suffer from superficial pain. Why? Because they don't get aroused, and without sexual arousal, it will cause vaginal dryness, which would cause superficial pain to such an individual. The third is anxiety, worry, or maybe individuals who are scared, and even anger towards your partner. So I would advise that as a woman, if you are angry with your partner, please try and resolve it before going to bed with such an individual, so as not to put yourself in that situation of pain, which is not good for you. If you are worried about the outcome or worried about getting pregnant, this should be discussed with your partner to be able to help you losing out and giving your best during sexual activities to prevent you from having sexual related pain. Also, stress is the last thing I'll be talking about as a part of the emotional cause of dyspareunia. Individuals who are stress affects sexual activity on a general level, and if you are stressed, you should try not to engage in sexual activity, as you might not really enjoy the outcome of it and you might end up having pain rather than having excitement like you should have. Next is the treatment of dyspareunia. I would be giving you my own recommendations, what I feel you should do for yourself when you experience dyspareunia, and based on the causes that I have shared here. Dyspareunia, one of the treatments for dyspareunia due to vaginal dryness for a woman who have just given birth or who is breastfeeding. Due to this drop in the level of estrogen, she and her partner can go for water-based lubricants, as this would help lighten up their activity. If pain is due to not being aroused, try to spend time and foreplay with your partner. Yes, if you are experiencing dyspareunia due to not getting aroused or not getting enough sexual excitement before going into the main activity, please try and spend more time in foreplay before penetration, as this would help reduce the occurrence of pain. The next thing, if pain is due to fibroid can be very painful and can also affect your sexual activity and predispose you to pain. If you're having fibroid, treatment options for it could either be tablets or you go for surgery to help reduce this mass in the uterus. We all know that fibroids are usually non-cancerous, so they can be removed. When you remove this mass, you will notice that there is an improvement in your sexual activity. Pain due to thrush or yeast infection can be treated with anti-yeast tablets, anti-yeast cream, or anti-yeast positries, or a combination of the three of them. If pain is due to traumatic activities, that's emotional based, I would advise such an individual book a counseling section so that the root cause of this should be well sorted out, and good counseling tips would be given to such an individual to help improve their perception about sex. If you are suffering from dyspareunia or painful sex, it is not something you should put up with, or you think you are the only one suffering from it. A lot of women out there are suffering from painful sex, but most of them have chosen to be quiet over this. It is very important that you speak up, you book an appointment with your doctor, as these are things that doctors come to face in their day-to-day of practice, and you don't need to be shy. All you need to do is provide them with the necessary sexual history, and they'll be able to come in the best way and provide you with options or treatments that would help improve your situation. Never you think that you're alone in this game of painful sexual intercourse, because there are a lot of women who are going through this, but they have chosen to be silent about it. A lot of women who are going through dyspareunia don't even tell their closest friend about it. Most people keep this as a major secret, as they do not want anybody to know about it. Pain during sex is usually not related to a medical condition. Sometimes it could be due to deep penetration, forceful sex, that's the partner who uses a lot of force in thrusting. It also could be as a result of the sex position that was used. So if pain during sexual intercourse are related to these three things I've said, all you need to do is to change strategy. If it is due to painful, forceful sex, then you tell your partner to go a little more easy. If it is due to deep penetration, you try superficial penetration. Then if it is due to the sex position, you change position, and you'll be able to help yourself and get relief from this particular condition. I hope this video have been helpful to you. Please do not forget to subscribe, like, drop comments on this channel. If you have any question related to this particular topic that have been shared, you can also drop that at the comment section. Thank you for watching.